Hello, everyone, and today we will be reviewing evaluation and management and case studies. My name is Cynthia Bennett, and I will be your facilitator for this session. Uh-oh. So just as a quick overview for the E&M section, these are some of the categories. You're basically going to have your office visits, your hospital visits, emergency room, preventative medicine, consults, nursing home. But there are some other visits as well, but these are the most common ones. So just as a recap. So in this section, you have some unique guidelines. Those guidelines are located at the beginning of the section for E&M coding, and it will go over some of the commonly used terms in that section. It'll give instructions. So as in other parts of your manual, your guidelines will always be at the beginning of that section. So I kind of put together some questions to kind of help guide you to choosing the correct code. And the reason why I did this, because on one of the assignments, I saw that there were some questions that were wrong with a number of students. So I figured that I would kind of put together some questions to kind of think about. So one of the things that you want to do is think about, is the patient new or if they're established? Because that's going to kind of give you an idea of what group of codes you're going to use. The next thing is, where is the location of the patient that they're receiving services? So are they in the hospital? Are they in the office? Are they in the nursing home? So those are things to think about, because that will also guide you to which section of codes to choose from. And then the next thing is, what is the degree of service that that patient received? So just some questions to kind of think about to put you in the right direction. So as a summary for the E&M section, they're basically divided by the site of the service, new versus established, also the history, exam, and the medical decision-making. And then some of your codes will involve time. So not all of your E&M codes involve time, but some of them do. So these are just the highlights, because we've already went over E&M coding before, but before I actually went into some of the case studies, just want to give you some of that background information. So coders need to read each section and the subsection to become familiar with the instructions for coding that particular section. And I would definitely do it now while you're actually learning. It takes a little bit more time, but then that will help you to choose the correct code. So I have an example here, and this is one of the ones that some students got confused with. So they're asking you to analyze this case. And so basically it's a 40-year-old male patient. They're new. They're being evaluated for a contusion of their finger. So the first thing that we notice is that this patient is new, because they're already telling us this. So that's something that we need to take into consideration. And if they're coming in for a contusion on their finger, that's usually going to require minimal history and exam done. So we'll keep those things in mind. So the record indicates that a history and exam was performed, and then considering the level of decision-making, what will be the CPT code. So we know that this is going to be minimal just based off of what they described to us. So in this case, it's going to be a level 2 new patient. I had gotten 99217 quite often for an answer for this question, but I just want to show you, some of the things that you want to look for. So And the first thing you want to do is, we decided that the patient was new. So we know that there are only a few sections in the coding manual that even talks about new patients. So that will kind of limit where we're going to actually use this code. So just think about those questions that I identified in the beginning when you're actually going to start choosing your codes. Because right now, this is where, the rubber is going to meet the road. So applying everything that you learned, and now you're going to actually start coding. So those are the things that you want to start thinking about. So in this next example, it's a 2-year-old boy with a bacterial pneumonia, and they're in the hospital. So that's the first thing we notice, that we're going to be looking for a hospital visit, because what? They told us the location is in the hospital. So we know, don't even look at new codes. Don't look at anything that has to do with the office. We can now only focus on those codes that are related to inpatient, because we've already identified that the patient is hospitalized. It's been 5 days. The patient developed a fever, 101 degrees with a mild rash. Then they identify in a subsequent hospital visit. So they're telling us that it's going to be hospital and it's going to be a subsequent visit. So they're already giving us 2 indicators here of where we need to start looking. The attending physician performed a problem-focused history and exam. So we're zeroing in even more, because now we know what type of exam that patient got and what type of history. And now we know that the medical decision-making is low. So we really only have about 3 options to choose from in this particular scenario. So those are the things that you want to start thinking about when you're going to start assigning codes. So in this case, it's going to be the 99231. And the reason why is because, again, we're looking at the subsequent visit, and then we're looking at the history and exam and the medical decision-making. So when you look at all those factors, that's how we come up with the 99231. So those are some little tips that you can begin to start looking at, becoming more comfortable when you're going in and you're coding these cases. So remember, if you have access to your textbook, remember that with access to that, you have a lot of case studies in there. You can start using those, coding them, and then checking your answers to see if you came up with the right answer. If the answer is incorrect, go back and look and see where I went wrong. And you can easily identify that. So for example, if you picked an office visit code for this, you know that, okay, I need to focus on the areas that only pertain to hospital. So it begins to show you where your weakness is. The only way you're going to get good at coding is by coding. It's by practice, practice, practice. There is no magic bullet. You have to know your guidelines for each of the sections, and then you have to then start applying them. So you have to do it over and over and over again for you to get good at it. So that's why I want to go back over E&M before we leave this section to point out what are the key things that you need to start looking for if you haven't already done so when you're starting to code E&M codes. Because when you start to code, let's say the next section, which is going to be your surgery, you're going to use totally different guidelines than you're going to use for your E&M. So just want to give a recap on the E&M. So any questions about the case study that I just went over? And if you do, you can always send me an email. We can talk about it later. So I have another case study that I want to share with you. So this one is a patient that's a 52-year-old male from out of town. They're visiting their daughter. He left his medications behind. So first thing we notice is that the patient is in a clinic. So now we know the patient's in the clinic. We know that don't even think about anything that has anything to do with any location other than and probably an office visit, because we know this patient is in a clinic. We know we're not going to use hospital, nursing home, or any of those other ones. So we can go ahead and eliminate that because we know the patient's location. Then we'll look at the history and exam. So we know that the history exam that was performed, and then we also know that the medical decision-making was straightforward. We know that the patient got a prescription, and then that ended their visit. So this one is another one where it's pretty straightforward. We know where the patient is. We're looking at that history and exam, and then we're looking at the medical decision-making. And if you notice in your CPT manual that your sections in your E&M, after you see the code, it'll have the history, exam, and then it'll have the medical decision-making. So once you look at the history, exam, and the medical decision-making, you can see the differences in each of the codes. So in this case, it's going to be a 99202. How do we know that? This patient has come in for this visit in a clinic. We know that they're from out of state, so we know that this is not an established patient. There's no way this could be an established patient unless it was identified in the note. They're not telling us that it's an established patient. So based off of them telling us that the patient is from out of state, that's why we're going to make the assumption that the patient is new, because there's nothing else to identify that that patient been there before. So that's why we're going to go to the new patient area, because they've already told us that this patient is from out of state. When we look at the history, the exam, and the medical decision-making, we know that it's basically minimal. So because of that, that's how we know that it's going to be a level 2 visit. So we know it's new patient, level 2. That's how we come up with the 99202. Looking in your CPT book, it will actually have, breaks it down, all of the different levels. There also are examples that are in your coding manuals. You can use those. You can make little notes like the 3 questions that I told you about for E&M coding. So these are all suggestions that you can do to kind of help you to get to the right code that you need to choose. So any questions about the case study that I just went over, or any other case study?
No, ma'am. I do have a question about when is our, like, will the next chapter be chapter 13?
I don't know offhand. We only have, I think no, it won't even be another week in this class. So probably not. I'm not 100% sure, because this class actually will be ending, I believe it is next Tuesday or Wednesday. So it's very short. So I'm not even sure, but I can look into it and let you know.
Okay, that's fine.
Okay, so as a recap for E&M, you just want to think about, is the patient new or established? Where's the location of patient receiving a service? And then what degree the service is. So what level of service that patient actually got. So those are 3 quick questions that you can think about when you're going to start working with E&Ms. Okay, so if you guys don't have any further questions, that's going to conclude our meeting for this week. So again, if you still have questions, you can always email me, but I just wanted to get together, give you some of those quick tips to help you with your coding, and just encourage you to continue to do the case studies and practice, because that's where you're going to get very good. Practice, practice, practice.
So a quick question before we ended. When you said, like, you know, do the case studies, so when we are doing the case studies, is it recommended that, like, you know, say if you search on Google because you're trying to find another case study, like, is that okay to do, or you would just recommend doing the case studies in the chapters? Because I have found like a few. Okay.
Go ahead.
Oh, I have found like a few case studies online. It, you know, it's random. It's not nothing related to like our book, but it was related to like the E&M. So I was like, I wonder if this is good or am I hurting myself?
No, it's good. And it's great that you're using other resources to kind of solidify what you're learning. That's great. That's why I use the YouTube videos. I recommend that you use YouTube and look at things that other people are doing as well to help them to get better with the E&M coding. So there's other places that have case studies, and if you find something online, that's great.
Okay, awesome. I just wanted to check on that to make sure that's, you know, helpful.
Yes, that's great. And that's good that you're taking the time to invest in, you know, learning this. Coding is not something that you're going to just learn overnight. It's just not going to happen. As you can see, it's a lot of information. So it'll be very difficult to try and learn it very quickly overnight. So doing exactly what you're doing, you know, you're doing your case studies, you're doing your assignments, and then you're also going out looking to see what other information out there that's available on that topic. So that's great, because what you're doing is you're solidifying what you're learning. You're building on top of what you're learning. And that's what's going to make you good. And once you go out into the coding world, there will be times where you may need to go and research something because you're not sure. And so by doing what you're doing, you're actually preparing yourself so that when you are on a job and you're working and you need to look up something, that you're starting to build resources.
Okay. Thank you. And the courses are just going to come weekly, like, is no pause or breaks, right? It's just like straight through?
Yes.
Okay.
Yes. And so next week, you'll start a new class next week. Okay, well, that's all I have for this week. I'm going to hang out a little bit to see if others join, to see if they have any questions, but this will conclude the actual recording.